I'm Vicki Libiakis, and welcome to Body Beautiful. This is a show where we talk with local professionals about the latest in cosmetic procedures and medical devices. We also take your calls live on the air. And with us today, we have plastic surgeon Dr. Elizabeth Lee. Today, we're talking about summer alternatives to plastic surgery. She's got some really interesting ones here. Later, we'll be taking your calls, answering any questions you might have about some of these options. Here's the phone number, 800-440-4884. We'll also be posting the phone number to the doctor's office, so be ready to jot that down. And before we get started, our caveat, any advice we give you today, you'll certainly want to consult your own physician as well. Welcome back to the program, Dr. Lee.
Thank you very much.
You are a plastic surgeon, are you not?
Yes, I am.
And yet the topic of this show is alternatives to plastic surgery.
Right.
Are you trying to put yourself out of business?
Absolutely not. But you know, surgery is a big undertaking, and there are a lot of things that we can do that make small, subtle changes that have basically no recovery period, and that can make you look great.
Okay, so somebody might come in and they may be obsessed with, say, jowls, and they're messing with this, and they think the only alternative
is a full facelift.
Is a full facelift.
Right.
And what do you recommend?
You know, it depends on what they need, but of course, I always talk about good skin, because no matter what, if you're wrinkly, and if you have a lot of sun damage, the wrinkles are going to look worse. So when people come in plucking at their cheeks and stuff, you know, I like to talk about whether or not we can do anything to improve their skin. And then, of course, we also have the fillers, which actually do a wonderful, subtle job of rejuvenating the face by putting fullness back where it should be.
There's something called a liquid facelift?
That's a phrase that's been coined, and what it is really using fillers to rejuvenate a face, because what we started to come to understand is that facial aging is not just about what we usually think about, which is loose skin, you know, too much stretched out skin and wrinkles. It's also about a shift in facial volume. So we start out with a lot of fullness around our eyes and cheeks, and we end up with hollows around the eyes and fullness around the jaw. And as things shift around, the nasolabial folds look worse, the creases under the eyes look worse, and we can pull skin really tight to try to make that look better, but what we're really doing by doing that is distorting the face.
Yeah, it actually looks cadaverous. So
yeah. Or windswept.
Right.
Yeah, windswept, the wind tunnel.
So the new trend is really to kind of plump it up to make it resemble the skin of your youth.
Right, and to make it resemble not just the skin, but the soft tissue contours. So when we talk about soft tissue, we mean the tissue between the skin and the bone. So the fat that should occur in the face.
Okay, all this sounds really complex, and that's in the hands of you. You're the artist, you're the doctor here.
Thank you.
But basically, someone comes in and you can actually see that if you just add a little bit here and a little Botox there.
Exactly. That's what I love to do as an artist. You know, is not to just address the patient's complaints, but also to talk to the patient and help to explain to them how the nasolabial fold might be what's bothering them, but when we fill that out completely, we're distorting the face, and that if we put a little gentle filler around the cheek, and I show them with my finger, I can do a lift in the office. I say, just look what happens to your fold, and they say, oh yeah, that's what I really want.
Well, we need to talk about this, because the bottom line here is economics as well.
Yes.
Say you're out of a job, you want to look better when you're entering the job market. It's not as expensive as full-on plastic surgery.
It's absolutely not as expensive as full-on plastic surgery. And I make a point when I see a patient in consultation of discussing the prices for them too. And I've had several patients in the recent past who've come in and said, you know, I only have X amount of money that I can spend. And I will say that then we don't want to spend it doing this, because with that, if you only do one syringe in this particular case, you're not going to get the correction that you want, and I think it's just wasting your time and your money. So that patient actually has been very happy that we've been able to do something. They came back later, and we did a little bit more rather than doing a little bit and a little bit and never seeing anything.
Do you find also psychologically and emotionally, you know, like small incremental changes just really help you along? You say, you know, I look better. People are responding to me in a way that kind of boosts my spirit.
You know, I do have people who come in and say, look, I'm in between jobs. I have 6 months off. This is the only time I'm ever going to have time to do anything. So don't talk to me about the little things. Do it all at once, because I'm never going to have the time. And those people are ready for a different kind of change. But it really is amazing how if you put a little filler in the right place, people will say, You look fabulous.
We've got a lot more in your bag of tricks here. We have to take a quick break, but for more information about Dr. Lee, you can call her office at 510-704-2170 or check her out on the web at artfulsurgery.com. We'll be taking your phone calls and continue our look at more summer plastic surgery alternatives when we come back on Body Beautiful.